Well, good morning and welcome again to our show. We are continuing our series with Dr. Stanford Owen with the Center for Health Management, talking about diabetes, type 2 diabetes, things that you can do to help fight it, help treat it in many different ways. I mean, whether it's through nutrition, medication, everything. Welcome again to the show.
Thank you. Good to be here.
Well, thank you very much. Let's talk some more about this. I mean, your Prescript Fit program, and this is a big thing for you, working with people who have type 2 diabetes.
Sure. So what I have laid out is all your treatment options for type 2 diabetes, which happily, I might say, is dramatically different than it was even a year ago. So prior to a year ago, I had very little to offer you other than nutrition. Nutrition is the first treatment for type 2 diabetes. As I say in every segment, food is the cause of type 2 diabetes. So food is the treatment of type 2 diabetes. In our usual algorithm that we show you, the purple foods do not cause type 2 diabetes. The gold foods cause type 2 diabetes. So
all the good stuff that we like, pork, beef, beverages,
dairy,
and
starches, especially the combination of the animal fats plus the starches. That is the cause of type 2 diabetes, and simple sugar like in beverages.
Oh, sure.
So in the healing process, in the treatment process, there is what we call an algorithm or a strategy or a step program that we add one on top of the next on top of the next. And unfortunately, nutrition therapy rarely gets its day. It's rarely offered. Every single patient with type 2 diabetes should be offered 12 weeks of intensive nutrition therapy. If they fail that, then we go to medication. And then we add a medication one step at a time until we, in the worst case scenario, reach insulin. And in my practice, I consider insulin therapy a failure. So that's always my goal, is to avoid getting on insulin. And we start, of course, with the Prescript Fit amino acids first, because those do not require your own body's insulin to be effective. So it gives your pancreas a rest. The diabetes comes under control, and then we add a food group one at a time, seeing how it affects the type 2 diabetes. And then when you finally get the diabetes control, then we add the good foods back in and start splurging. And 1 or 2 days or even 3 meals a week is not going to affect the diabetes terribly, so you can actually put these foods back into your life, which is the fun thing to look forward to. And what happens is, when we start treating it, is the fat cell is actually the cause of the type 2 diabetes. And everybody knows that their belly expands as we get older.
Oh, yes, too well.
Yeah. We get resistant to our own insulin, so we start making more and more of our own insulin, which makes our fat cells grow even faster and bigger. So your diet may not have changed much, but your belly's getting bigger. And this Bubba fat cell expands in your belly, produces large amounts of hormones that then cause all kinds of changes in your chemistry and cause all of these diseases, including type 2 diabetes.
Wow.
So when we feed the fat cell differently, first with simple foods and then adding a food at a time, these hormones go back to normal, and the diabetes goes into remission or disappears with a normal blood sugar. Now, either patients cannot follow the diet or will not follow the diet, or in rare cases, it doesn't completely control the blood sugar, in which case we start adding medications to that treatment strategy. And historically, we add metformin second, which affects how the fat cell processes sugar through the liver and the muscles. Then we add something called glyburide, which makes your body secrete more insulin, which really doesn't help very much. Now we have a whole host of new medications. Pills that cause you to excrete sugar. We have pills that help your muscle process sugar better. We have medications that make the fat cell change how it produces insulin. And then finally, we have a once-a-week injectable. There are 4 of these now on the market. These are just 2 of them that mimic some of the hormones that food messes up. So food will cause the hormones that suppress type 2 diabetes to disappear. These are those same hormones, so we actually inject these back into the body. And in the worst case scenario, we have insulin. And unfortunately, a lot of patients are started on insulin when they start treatment. This is the last treatment that should be added. In my practice, 100 or so diabetics, 4 patients are on insulin, so roughly 4%. And that should be the average. And most of those 4, 3 have a hard time complying with their diet, and 1 has been a diabetic for almost several decades.
So a lot of it is, the really important part of it is your diet.
It's always
your diet.
The important part of the diet.
I mean, Mississippi's top of the list for people that are diabetic?
Yes.
Because we have a tendency not to be the smartest here. We love to eat,
And there are tens of thousands of patients on the coast who are on insulin, and from my perspective, needlessly. And needless to say, this is very costly. Not only are you sticking yourself one or several times a day with a needle, but you're pricking your finger to check your blood sugar.
Right, right.
When a patient gets control with diet alone, once a week is enough to check your blood sugar. So
Wow.
your cost of just a little lancets is crazy expensive. And that, of course, diminishes and disappears since you don't have to prick yourself so much. And it's, you know, it's pretty simple. It's about food strategy, not food elimination. We actually add food into your diet. In our diet strategies, it's all you can eat, because it's not the weight that causes the type 2 diabetes, it's the food that affects the fat cell.
Right.
And so the real strategy is how can you manage animal fats, pork, beef, dairy, combined with starches, wheat, corn, rice, potatoes. And that's a tough thing because our culture is built up on those foods, especially fast foods.
Well, it's like you said, I mean, eating sensibly, you just take them off of the bad food to begin with, but after a while, you do introduce that back into them.
Right, and we call it damaging food, not bad food.
Okay, damn, food that's not so good for you.
And we're composing a list of almost all of the fast food restaurants now have items on their menu that are diabetic friendly, and we're composing a menu of all the fast food places and where diabetics can actually go to.
Now, what if you see on a menu it says gluten free? Is that good?
Well,
does it make a difference?
It doesn't make any difference. Gluten is people have jumped on the gluten bandwagon, sort of missing the point. It's really not the gluten, it's the starch. And so when people get off gluten and they feel better, what they did was they got off the starch and then they quit stimulating this fat cell to make all these really toxic hormones that make you feel bad.
Wow.
And so it's really, it's very, very simple. 1, 2, 3, 4, 5, 6. Most of my patients who come to see me who are being treated elsewhere are on 5 or 6 medications. And we start them on a 12-week program and we back these medications off one at a time until we get back to hopefully just diet alone or diet and maybe 1 or 2 medications.
Well, this is awesome. Of course, this is a continuing series that we are doing with Dr. Owen on diabetes, how you can fight it and live with it and hopefully get rid of it.
Flick the stick.
Flick, I love that, flick the stick. So if you'd like for some more information, the website's on your screen there. Of course, you can call Dr. Stanford Owen at the Center for Health Management. If you'd like to set up an appointment for a consultation, they'll be glad to sit down and have a talk with you about it. Once again, if you want more information, go to the website on your screen or give them a call, and we will continue as we go down the line with our continuing series on diabetes with the Center for Health Management here on the Gulf Coast.